Welcome to Enlightened Connections, a space for intuition, healing, and remembering what connects us. I'm Lisa Aston Michael. If you'd like to continue these conversations, follow on Spotify and stay with us. Welcome everybody, and today I have a very special guest with me. I have Dr. Jefffrey Feinman, who is a certified veterinary homeopath and molecular biologist who is transforming the way that we approach health and well-being with a unique ability to bridge leading-edge science and a deeply compassionate, holistic philosophy. Jeff empowers pet parents to support their animals' innate healing potential. He's the founder of Holistic Actions, an online platform dedicated to conscious, compassionate pet care, and the creator of the BEAM blueprint. Now, for you listeners, BEAM is an acronym for Behaviour, Energy, Appetite, and Mood. And also the conscious, compassionate communication, which Jeff describes as his C3. Through his work, teachings, and his book, Path to Pet Wellness, Jeff inspires a global movement toward more connected, heart-centered care for animals and the people who love them. Welcome, Dr. Jefffrey Feinman.
And thank you, my friend, for inviting me. And I'm sorry about any noise that I decided she want to play with their ball right now.
You know what? We're talking about dogs. For the listeners that can't see us, both of our dogs are decided to join us today. So dog noises are quite acceptable in this situation. Right. Look, there's so much I want to talk to you about. I want to talk to you about your book, The Path to Pet Wellness. I also want to just touch on the article that you wrote, how a holistic approach to animal care can awaken human consciousness. But before we get into that, let's start with this. Your journey is fascinating. So what first led you to explore healing through love, presence, and energy right alongside science?
It was a path for me. It was a long and winding path for half a century's worth. And really was observation. The answer to your question is just, seeing what worked over 40 years of being a vet and feeling, as that invisible heart-centered energy that was healing and seeing it in action.
I've seen through your writing that one of the things that, vets are very, how would you say, grounded, based in the training. One of the things that I really wanted to ask was, as a allopathic vet, in your experience, did you have moments where you felt that you were receiving messages or you were feeling, hold on a minute, I think it's this due to the symptoms, but am I crazy? This animal is telling me it's that over there.
Oh, what a great question. Never been asked that, and the answer is yes. And I learned very well to tune out those messages, those feelings. That's what they teach us as doctors.
So how did you deal with that?
Anxiety, depression, fear. I mean, a life of being unaligned with what you're describing, which is the reality of life. I never would have dreamed. If you asked me 20 years ago if I would be in this space, no. Because I started 100% really as a conventional vet that was actually on this specialist track. I was going to be an endocrinologist and the aging specialist. But then I began to see what reality really brings. And what we saw in the lab or in the academic vet setting is different than what I saw as a house call vet in the 80s when I saw things at home.
Clearly you had a bent towards animals. When you were, going back to being a kid, did you just love animals, or did you have a connection with them that drew you to want to be a vet?
Don't know. I just know that I felt at the age of 5 that I was always gonna be a vet. I never wanted to be anything else. I did not have that magical spiritual love connection with animals. I had my pets. I was a good animal owner, but I wasn't yet a kahu. I wasn't yet a real true guardian.
I know what a kahu is. Yeah. It's just so exciting to talk to you about what you do because I'm one of the people that have woken up to what you're talking about. I get it. I get it. And I think that one of the things that we'll touch on right now before we go too deep here is, can you explain the BEAM blueprint, the behavior, energy, appetite, mood blueprint?
I would be happy to, as long as I can go back a step about what really matters, in the path to wellness paradigm.
Yes, please.
And that is energy. So an energy balance with all of the physical stuff, the symptoms, the diseases, the diagnoses, labels, all the stuff that we learn to focus on as doctors, with all that being secondary to the underlying energetic fluctuations. And BEAM is a biomarker. Remember, I'm uh, a veterinary and a scientist by training. So, I'm always looking at the biomarkers, internal and external. And BEAM is one, like any of the ones that we have, that reflects quality of life and energy balance. Because quality of life and BEAM decrease as the energy becomes more imbalanced. So in other words, when we become diseased, our energy is getting imbalanced and our BEAM is getting lower. As our BEAM gets lower, our susceptibility, the chance of getting sick, gets higher and higher.
For the listeners, I want to read something that is in the foreword of your book, Path to Pet Wellness. And I think this covers a lot of what you're all about. The bond between humans and non-human animals transcends mere companionship. It's a sacred covenant that immeasurably enriches our lives. In Path to Pet Wellness, Dr. Jeff Feinman invites us into this hallowed space where science meets spirit, where veterinary expertise blends with profound empathy, and where the true needs of our animal companions come into sharp focus. Now, what distinguishes this remarkable book is its unwavering dedication to viewing wellness through the animal's perspective by asking this question: what would my pet choose? So, can you walk us through how that one question can completely transform the way that we care for our animals?
Sure. At essence, that question is because we always want to be going with the flow, just saying yes, aligning with universal principles, aligning with Mother Nature. And by being a dog, you actually are able to align better than we as people, because they're outside of their head. And so what does that mean? That means that you get down, you look at where they're looking, and you may bark when they're barking. Yeah, you basically become a dog. And as you become an animal, learn to play, learn to love, and just to be out of our minds and into our bodies, then we can begin to become more conscious and awakened, as animals are already.
So, this is more of an understanding between human and animal rather than looking at your dog from an anthropomorphic perspective.
No anthropomorphism at all. It's very objective. I mean, because the entire framework is based, and this is not what Dr. Metcalf was talking about. The whole framework is based on what the dog's body is telling you, and respecting that instead of working against it. That's why I started by saying, just say yes instead of no, 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 no with an anti. We're going to use anti. We're going to fight the battle against disease. Like, oh no, our dogs don't need to. They just need to
Okay.
realign with the flow, the energy flow that is reflected by beam.
Okay. So I think one of the difficult things for us as human beings is to, if we can look at behavior, let's start with behavior. I see so many people trying to train a dog into being outside of its natural character. But there's also a line in the sand. For example, if you have a big dog, like a Rottweiler or a German Shepherd or something like that, that to me, these dogs, and please correct me if I'm wrong, appreciate discipline and guidance. But there's got to be a line in the sand as to when we start to cripple their natural instincts. Can you talk to me a little bit about that?
Gladly, because I just had a training session with my dog today, and recently I had to use balance training. Balance meaning that you're on that line between positive, giving him more of a being more of a leader than necessarily I was the first year for life when we spent a really just developing relationship. But she's a big, tough dog that, has to get trained. And she knows her basic commands, but if there's a squirrel, she's out of here. So, and if it's across the street, so yeah, for her own safety, for the bigger picture, for my being able to, in a couple of years, being able to take her everywhere. I mean, I love her to be my balance assistance dog. I need, help with balance when I walk. But she does need to be on that line. And I used a year of choice-based training only with her, and I wasn't able to, not that it doesn't work, but I wasn't able to give her the leadership she needed. I was letting her make too many decisions.
Mm. Similar to guide dogs too, I suspect. They wouldn't be very useful if they weren't trained to be the leader, would they? So
Thanks.
it's quite an interesting field, isn't it, behavior, when we look at that? Natural behavior versus learned behavior, or training to a degree, but not overtraining, not making that dog do something that it's not meant to do. Yeah. And energy, if we look at the next step in BEAM, energy is everything, isn't it? Because we can see the difference. We can see when we look at, for example, dogs that have been in rescue centres or dogs that have been in not so happy homes, and their energy is completely diminished. You look at them and they've shrunk. So a healthy dog, to me, would be one that is, you can sense that energy outside of their body, that way out in their aura. It's exciting, it's curious, it's fun-loving, and that would indicate a degree of health, would you say?
I would agree with that 110%. Yes.
Yeah, we don't see it so much today in our society, because dogs, primarily, people have so many, particularly where I live. People have them for protection. We have a lot of crime here. They get a big dog. They think they're going to be safe. But the problem is the dog doesn't get out much, doesn't get walked. It doesn't get appreciated, respected, recognized. It is, as you were speaking about in your article, I believe, I read it somewhere, is that our dogs don't get recognized for being sentient. And they are sentient beings. If you put a child in a room and left them there for 8 hours a day, 7 days a week, what type of kid do you think you're going to end up with? Right? But it's okay to do, people think it's okay to do that to dogs. Yeah.
Yeah, we're very, very lucky that we're living in a society where that is changing a little bit. Well, I think that in our parents' generation, that was, yeah, common, and now d- don't hear it in my clients that often. But granted, I'm seeing a very biased sample. I'm seeing the guardians. I'm not seeing the owners.
That's beautiful. And I agree with you. There are changes happening. People are curious. They want to know more about connecting with their dogs, connecting with their animals. But I think they feel sometimes that it might be borderline woo-woo. What do you mean I need to tap into my dog's energy field? What the heck is an energy field? So we weren't taught that. My generation, we were taught about energy fields. We were taught
No,
this is it.
and then that's disconnect. The fundamental disconnect is what you just described. The fact that we're alive. We're alive because of the energy in the body, and that energy you and I know as love energy, the conscious energy all around us. But as a molecular biologist, I had to break it down to molecular level, which was non-woo-woo, which is why what we're talking about, my friend, it's called the mitochondrial theory. And you've heard of the polyvagal theory? This is the mitochondrial theory. That the mitochondria rule the body. Well, it just so happens the mitochondria are the energy generating parts of every cell of the body, of everybody. And the science is now documenting that almost every disease they've looked at fundamentally is a mitochondrial energy defect. Certainly every brain disease, every heart disease, mitochondria and energy are in a huge demand in the heart and head. But they are throughout the body because they run everything. And then the question becomes, that's physiologic. Mitochondria are physical. We're talking about, a kind of energy that's not physical. So what is that?
I was going to ask you, to what degree do you feel the emotion impacts the physical?
Great degree. And we know that from research validated science, from as simple, from as basic as our observation changes the way the outcome is in a physics experiment. The wave becomes a particle, or the particle becomes a wave. But in practice, when you visualize, I'll use me as an example. When I turn 80, if I visualize myself as a 90-year-old or a 95-year-old versus, oh, maybe I'm going to probably not live much longer. That is research proven. That mindset shift is called age belief. And as Dr. Levy proved up at Yale, age belief, if you change your age belief up to 80, see, even when you're 80, if you say, oh, I'm going to live till I'm 105 the way you should, you're going to live 7 more years. 7 extra years, I should say.
That's powerful. That's powerful.
And all I'm saying is we can do it with our animals. So when you go to the vet with your 12-year-old cat and they say, oh, he's an old cat, his kidneys are failing, just get up. You realize that, the fact that a 12-year-old cat is a middle-aged cat and that they have a long life ahead of them, and visualize that. Don't visualize your cat as a sick cat. But, that's really, 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 really hard.
Yeah, it is, I think, because you've got your own personal issues, I suppose, and you bring your own beliefs into it. So it's really about changing or adjusting the belief system in people as well to the possibilities of it's science. It's not woo-woo, it is science. Science has proven that this can happen. Thoughts become things. We all know that. Joe Dispenza speaks about thoughts becoming things and how the power of the thought and how it adjusts and modifies energy around us. And, for people that say, oh, I actually had a woman say to me, I don't believe in energy. And I said, well, stick your finger in a light socket and come back and let me know how that went. People say the most in crazy things. But, the average person has been raised to believe that the answer to everything is take your dog or your cat or your horse to the vet or whatever. And that's fine. I'm not in any way dismissing veterinarians. But I like that you spoke about people taking a little bit more responsibility, becoming more aware of possible prevention. I don't know, possible prevention by watching Firstly, watching them, watching what's happening with their appetite. Now, I have one poodle here that is a rescue, and I thought for many, many months he was happy to live on air. He wouldn't drink. He wouldn't eat. I have tried every variety of food on the market, fresh, air-dried, air-compressed, not fresh, you name it, I've done it. And I've given more food to the vets, 3/4 of the food I bought to the vet, because he will not eat. He likes it today. I don't like it tomorrow, and he's very fussy, very poodle-like, breed-specific. The other one, she will eat anything, anytime, anywhere. Not a problem. The thing that I'm finding interesting is the different personalities, the unique personalities, same breed, totally different personalities. So I adjust myself to work with both of these dogs, but I have to adjust to them, not expecting them to adjust to me, because it doesn't work. What would you say to people that might be in a similar situation where they have different animals and they want the best for them? How would you guide them into understanding about the different characters of their animals and how to work with that comfortably and safely?
I think that there's no debate that everyone knows that we're all individuals, that we are all, different, like snowflakes, and we can easily apply that to our animals. And I'm going to go back to science, because the answer to your question is to empower those people with scientific wellness. Scientific wellness is the 4 Ps that describe scientifically what you just said. And the 4 Ps are: 1, personalized, which means individualized, not based on the disease name, not based on the symptoms, but based on the individual. Number 2, predictive. So if they have a low beam, you can predict they're going to probably get sick from something. Number 3, proactive or preventive. You can actually prevent problems by doing the 4th P, which is participating. And we know in medicine, I don't think there are any studies in vet med yet, but we know in medicine that participating in your own care improves the outcome of whatever the treatment is. So you want personalized, predictive, proactive, and participatory medicine for everyone. And it just so happens that that's what we're talking about.
Yes.
I would start by empowering people with the fact that they need to take some of the power back. Because you're right, it's become ingrained. I think it's less so in the younger generations that they give their power away to others, but many of us see a symptom, we freak out, and we run to the vet.
Mm. Yeah.
That is really an okay thing to do, but it's the next step. So your vet's going to look at them, they're going to do any diagnostics, but then you've had time to pause and think a little bit about the bigger picture about, is your animal having these recurrent ear problems, or they're having the same thing over and over again? Maybe doing the same thing over and over again isn't really the answer.
Mm.
So that really, I guess, is the one thing that we wouldn't get across, is that it's good to once in a while think differently about a different approach.
Speaking about thinking differently, the one thing that I've noticed is that nutrition is something that has never really been focused on from a clinical point of view. It's been reactive solutions. There's always some medicine to give something at the end of the day. And and I used to think, well, could it be the food? But even nowadays, you see so much kibble so much kibble everywhere. And you speak to animal nutritionists who seem to be separate from vets. And I think, why isn't this part of the allopathic care? Why isn't nutrition more important here? Because surely that plays a huge part in disease. Your
And we know it
thoughts?
does. Well, we know it does, and there are indeed veterinarians that are specialized in nutrition.
Wow, wish they were here. Very hard to find.
Where are you?
I'm in the middle of nowhere.
You're in the middle of nowhere.
I'm in Cairns, but Great Barrier Reef in Queensland, Australia. We don't have a holistic vet here. And if I need advice on nutrition, I have to go to a specific animal nutritionist 2 states away.
Or call the Holistic Actions, or another reliable resource where you can ask your questions and get the advice. It just so happens that Monday we have weekly webinars as part of our membership, and on Monday we start our food month. In fact, I was just working on the food resources, and what are we going to teach in April? Are we going to teach about the right percentage of micronutrients and macronutrients and focusing on molecular level? No. We're going to focus on one thing: vitamin V.
Vitamin V?
Vitality, baby.
Oh. I'm thinking, I've never heard of vitamin V. What's he talking about?
Sorry about that. That's an inside joke.
I love that.
But it is true. It's, so the vitality of the food is most important. And that's where the fresh food versus processed food comes in, because we know that in people, the more processed food we eat,
yeah,
the higher our diabetes, our obesity, our cancer, our heart disease.
Yeah.
Those studies are now being done in dogs. In fact, Dr. Youngcut just published a study about feeding a fresh food diet versus feeding a kibble diet.
Yeah. Back in the day, I don't know if you had this where you are in the States, but we had PAL, P-A-L, PAL dog food. That was pretty well it. And when I was a kid, our Labrador was fed a tin of PAL, a bowl of kibble, and given a bone that looked like, it was the biggest bone I've ever seen in my life. It would last, I don't know where it came from, but this great big bone, and that would keep him happy all week. Now, I think back in those days, the PAL dog food was actually horse meat, right? Kibble, who knows? But the big bones kept their teeth beautiful and healthy. Nowadays, I feel that dental is one of the biggest problems that we see. And because dogs aren't chewing these big bones anymore, we're being marketed more towards these synthetic dental sticks and things like this. And the old days of just chuck the dog a bone and his teeth will be fine doesn't seem to be as popular as it used to be. And I guess dogs have modernized in their physiology like we have, but surely there's that inherent sense of, I need to rip something apart. I need to chew marrow. What do you feel about that?
They love it. And that is something that I have a question first before I answer. So I'll trade you. Yeah, it's my question. When you're a kid eating PAL food, how old did your dogs live? In the 50s, 60s?
I can't actually answer that because he had an accident and we lost him when he was about 5 years old. So I don't have an end result, unfortunately.
I can answer that. What you described, did Pal go to the vet all the time?
No, very rarely. He was a Sing-Eye dog that had been repurposed. Yeah.
Great. That's a great example, because at least in the States of Sing-Eye dogs, you have all the vaccines, have all the drugs, when they're younger. Despite all that, how was in good balance for his life with you. I guess I would have to go back to the 50s before the dog food craze really became big, and large breed dogs that are now living to 7, 8, 9 years of age live to 17.
Wow.
And yeah, and then it's been gradually decreasing. And I definitely don't think it's the food alone. The food is one of the easiest variables to modify.
Yeah.
Why is it so easy? Whatever you're feeding, just add a little fresh food. Add an egg, add, some meat, add some fresh. One thing I'd avoid, and there are foods I would avoid, but the one meat I would avoid is cooked red meat. If you're going to use red meat, it's got to be either rare or raw.
Right. Okay. That's good. That's very good to know, actually, because I think it's difficult for people these days to choose a good diet because there's so many. We're told so many different things. Don't feed them this, feed them that. Don't feed them that, feed them this. And it's like, this is good for them, that's not good for them. And I guess they tell you in their own way, they tell you too what they won't eat, what they don't like to eat. And I think that's really important. Mood is something else that I wanted to touch on. And I think, again, I wanted to ask, how much do you see animals responding to their people?
A lot. A lot, a lot, a lot. So our moods definitely do, and the mood in the household definitely does affect our dog. I mean, think about it. You have well, not you, but there's an argument in the room, and you walk into that room afterwards. It's like something feels off,
Yeah.
and they're more sensitive to that than we are. Now, they're also more resilient than we are, so they may not show it, but yeah, I mean, I know a lot of dogs that become very fearful if people are arguing or even, saying something loudly. So yeah, but you did the M part. The mood is perhaps the most subjective and the most anthropomorphic of all the beam,
Mm.
because you can sense when your animals are off.
Yeah.
And that energetic sense that you can feel as as a guardian that lives with your dog that your vet won't be able to find on a test, that is the early sign of imbalance right there.
Do you talk to your patients about what's going on in their life? If they come to you about, oh, my dog doesn't seem to be very happy, do you find yourself going, okay, well, what's happening in your life? What's going on in your world? What's changed in your home?
Uh, we do often get there, but not. I don't. It's not my place to ask, But I almost always do. They almost always volunteer and say, I know my dog got sick because we're fighting all the time and having.
People definitely know, don't they? I love the story that you told about a little dog that came from a rescue situation, and she was shaking and terrified and cowering in the corner and didn't want to do much, but their person reacted in such a beautiful way. So when she would cower under the bed or in a cupboard, or wherever she did, instead of trying to, come on, out you come, and entice her, they actually made a safe space around where the little dog was feeling safer. And gradually over time, that dog ended up coming for a cuddle. I thought that was absolutely so beautiful. And that marries into what you're talking about in terms of being aware of the energy of the dog and respecting it as a sentient being and being gentle, being ever so gentle. They're so sensitive. Animals are so sensitive
Mm.
and trusting. We don't trust anyone. Humans, we don't trust anybody, right? But they're like, I trust you first until you give me a reason not to. We're the opposite. I don't trust you until you give me a reason to.
And even if you do something untrustworthy, they may look at you askance, and then they trust you again 5 minutes later.
Yeah. Yeah, if only people could do that, huh? Let's just come back a little bit to the book here. In your book, Path to Pet Wellness, your approach beautifully blends science with an energetic or holistic with a W. I like how you express that perspective. So how can everyday pet owners begin to explore this without feeling overwhelmed or out of my depth, or I'm not vet trained, or I don't know what I'm doing, I'm not an energy healer? Where do they begin?
Well, the book was written so you get on a flight, 2 hour, 3 hour flight. When you get off, Del, the answer to your question is learn that there's a different way. That different way, I'm not going to say guaranteed, but it's going to resonate with you because the reality always resonates with us because it brings us back down. We're being grounded by reality. And really, it's not about, it's about the approach, the framework. And all pet parents, I mean, I say in the book multiple times that you do not need any science training whatsoever to do this. You just need to be a heart-centered, animal-loving human being. You don't even have to be an animal-loving human being. You will become one.
Yeah.
Maybe a person that loves nature and hiking, and eventually you will rebalance because that is the same framework in nature that we see in our animals. All living beings are designed to rebalance and ground themselves.
I would say to guess that we're probably the most out of balanced and ungrounded species on planet Earth at the moment. We're all,
Because it's that,
yeah, we're all too cerebral, aren't we? Instead of living in the moment and just living with our heart and being truth. Being truth. That's what I love about animals. They're truth. They can't lie. They're truth, right? I remember, are you aware of Steve Irwin? He's passed on now. He
yes,
was a famous
yes,
crocodile.
yeah. And his son was on Dancing in the
Yeah,
Stars.
and he won. Yeah, he won.
That was great.
But you know what? I remember a journalist interviewing Steve Irwin once, and he asked the question, aren't you afraid that a crocodile will kill you or attack you? And he said, no, I'm never bothered about that. I'll never die from a crocodile. He said, well, how can you be certain of that? He said, because they don't pretend to like you first. I thought you might like that. And
that is a good one.
It is a good one. You can have that. But, that's why animals, we're drawn to animals so strongly because they are in the moment and they do tell you the truth. There's another thing that I want to read here from your foreword of your book. It says, for anyone who has ever gazed into the eyes of a beloved pet and glimpsed a sentient being worthy of profound respect, this book provides the roadmap to honour that recognition through enlightened care. And I'm going to say this, that I urge you not only to read this, but to share it widely, which is exactly what I'm going to be doing. And after this conversation, I'm going to be buying your book because I have read. Oh, and also I'm going to be sharing your article with All and Sundry, How a Holistic Approach to Animal Care Can Awaken Human Consciousness. I feel this is the perfect time for this to happen because we are awakening as our human consciousness opens up. Without getting too woo-woo here, but we are asking the bigger questions. We are going, well, hang on, there's something shifting here. What's going on? There are more people, I know this is not your field, but there are more animal empaths, animal intuitives, interspecies communicators. And it's not modern. It didn't happen last week. This, again, you were speaking about the Indigenous peoples of the world. We don't need to talk about individually the Aboriginal people, the Native American people, and so on and so forth. All had this beautiful open, even biblical, the religious texts speak of animal interspecies communication. This has been squashed. This has always been there. And what you're doing now is bringing that awareness back to people. You don't have to be a mystic. You just have to be someone that's willing to open up to the truth of animals, to the truth of our relationship with them and their relationship with us as guardians, as healers, as friends. as companions that are worthy of respect and recognition as individual sentient beings. So for people that want to get hold of your book, I have some links here. Holisticactions.com would be your primary website. Yeah. You also offer a free course, which is a beautiful thing.
The basics, the fundamentals of this approach. Great. We'd love everyone in the world to take that, because that will ground them in the approach that we just talked about.
They can also get a copy of your book through your website, holisticactions.com/book. And the book is, I've mentioned multiple times, Path to Pet Wellness. You're also on Facebook. You're everywhere. So I'm going to put those links in your episode notes so people can reach you. Now, is there anything else that you wanted to mention today that we haven't talked about or touched on? Maybe one thing. For someone that's listening, what one thing can they start doing right now, today, that would have a meaningful impact on the animal in their life?
The one thing that would have a big impact is play more, purr more, let your animals be themselves, their true selves. Go out for a sniff walk, what I call a therapeutic sniff walk. Do some play with your kitty cats. Play the hunt, catch, kill, eat game with your cat, and they will be thrilled with that. Just throw treats for them and let them pick them up. Because as they get happier, the mitochondria get happier and their energy balance improves. And frequently, I just had this last week, frequently symptoms just go away, because symptoms are clues that the mitochondria aren't happy. And going outside, going for a walk, playing, that's going to upgrade the mitochondria, upgrade our life, and bring us one step closer to awakening.
Oh, that's beautiful. That's beautiful. Now, Dr. Jefffrey Feinman, I ask all my guests one question. Oh, you're looking at me very worried. It's a very simple question. But if you had one message for the world right now, what would that one message be?
Be nice. Love more and be nice.
That's it. That's it. Thank you so much, Dr. Jefffrey Feinman. Thank you so much for your time, your wisdom, your skills, your knowledge, your passion, and your love for our animals on this planet. Thank you so much. It's been an honor and a pleasure.
Thank you, my friend. I appreciate it.
Bye for now. Thank you for being here and for listening to Enlightened Connections. I hope today's conversation offered you insight, reflection, or a deeper sense of connection. If this episode resonated, please follow or subscribe and share it with someone who may benefit. You can also join me inside the Enlightened Connections Facebook community. I'd love to welcome you there. Until next time, take gentle care, stay connected, and trust the whispers.